So today I will review persistent marked CSF eosinophilia in a dog with primary central nervous system histiocytic sarcoma. This is out of Veterinary Clinical Pathology and is published in July 2022. This again is not open source, so I will go through the abstract, adding bits of detail as needed, and giving you my thoughts on the paper. So this paper is about a 6-year-old female spayed Jack Russell Terrier that was evaluated for episodic seizure-like activity and intermittent uptundation over a 3-week period. MRI of the brain revealed mild generalized dilation of the ventricular system with periventricular edema, a focal area of mildly increased lepto and pachymeningeal contrast uptake in the region of the right parietal and occipital lobe was observed, leptomeninges being the enhancement between the sulci, and the pachymeninges as being the enhancement on the surface of the brain. Analysis of these CSF revealed marked pleocytosis with a cell count of 635 cells per microliter, with 20% eosinophils, and no atypical cells or microorganisms were seen. The dog transiently improved with prednisolone for suspected eosinophilic meningitis / meningoencephalomyelitis of unknown origin, but worsened over the following 5 months after medications were discontinued. Brain MRI and CSF sampling was repeated. Additional multifocal lesions were evident in the brainstem and cerebellum. On CSF analysis, the eosinophilic pleocytosis and increased total protein persisted. The clinical signs progressed despite treatment with cytosol, cyclosporine, and prednisolone, and the patient was euthanized 6 weeks after restarting treatment. A post-mortem examination was performed. Histopathology and immunohistochemistry revealed a multifocal neoplastic proliferation of cells in the brain, diffusely and strongly positive for ionized calcium binding adapter molecule, or IBA1, which is used for staining of histiocytes, and it was negative for pancytokeratin, which evaluates for carcinoma, and for the gliofibrillar acid protein, or GFAP, which is immunostaining for usually astrocytes, although it's not perfect for that. And it was considered to be consistent with a diagnosis of histiocytic sarcoma, largely because of the positive for IBA1, and then negative for pancytokeratin, and negative for GFAP. No other organic lesions were found, therefore the neoplasia was considered a primary histiocytic sarcoma of the central nervous system. This case report stresses the importance of considering primary CNS histiocytic sarcoma in the differential diagnosis of dogs with marked CSF eosinophilia, even in the absence of atypical cells on cytologic examination. Recall other differentials for eosinophilic pleocytosis, including idiopathic inflammatory conditions such as eosinophilic MUO. Then there's infectious meningitis, so this could include cryptococcus, algae, or protozoal infections, and rarely bacterial. There's perineoplastic phenomenon that have been reported secondary to lymphoma, and a reaction to larval migration, such as Angiostrongylus vasorum. Eosinophilic MUE is the most common reported cause of eosinophilic pleocytosis in the CSF. There are several reports of eosinophilic pleocytosis being present with histiocytic sarcoma, and this group does a great job going back through the literature to tease out that information. Eosinophilic pleocytosis is also reported with oligodendroglioma, T-cell lymphoma, and meningioma, but is rare with all of these tumors compared to histiocytic sarcoma. Thus, even with an eosinophilic pleocytosis in the absence of neoplastic cells or infectious organisms, neoplasia cannot be ruled out, such as histiocytic sarcoma. And histiocytic sarcoma is thought to be more common in the Bernese Mountain Dog, Golden Retrievers, Rottweilers, Shelties, and Corgis, but as with this paper and what's previously reported as well, it can happen in any breed, such as the Jack Russell Terrier here. Again, another fairly straightforward article, but it is very informative and a good reminder of how elusive neoplasia can be. It is surprising the dog lived as long as it did, with the median survival time for histiocytic sarcoma being quite poor. Looking at the MRI compared to the gross images, I don't see a lot of the lesions, and I would agree based on what's seen on MRI and the response to treatment Eosinophilic meningitis would have been my first thought in this patient. It is possible that the dog had more than one thing going on and maybe had eosinophilic meningitis initially, and it just happened to develop histiocytic sarcoma later on. But given the similarities in the spinal taps, I feel this is less likely, although I guess we can't say for certain. For anyone who is able to download the article, which the link is in the description, the discussion is very much worth a read, as is reviewing the images in the table provided. But that's all I have. Thank you for listening.